We're going to talk about hydrocephalus. So hydrocephalus is basically the abnormal accumulation of CSF in the ventricles. All right, so what are the causes of hydrocephalus? So you think of accumulation of fluid, which causes increased intracranial pressure. I wonder why it's in the same chapter as intracranial regulation stuff. Okay, so causes. It's most commonly seen in premature, can occur at any age, and usually apparent in early infancy. So, some reasons that we may have underlying reasons so we get a base understanding is our tumors, meningitis. Head injury, subarachnoid hemorrhage, meningococcal, whatever. Anyways, that's our exemplars, like all of them. Okay. So let's talk about clinical manifestations, and then we can talk about what our diagnostics would be. Actually, we need to talk about the types first. Okay. So pathophysiology, our first thing to know is it could be caused by multiple reasons beyond just the underlying causes, but I mean the pathophysiology. So there could be an increased accumulation of CSF in the ventricles, compress the brain substance, stuff like that. All right, so there could be an impaired absorption. That could be one reason for increased fluid. There could be a blockage of flow of the cerebrospinal fluid. There could be increased production. So there's multiple things going on here. That's just the pathophysiology. Now, there are three types, communicating, non-communicating, and normal pressure hydrocephalus.
You're doing great.
Thank you. I appreciate it. So communicating obstruction outside, she wants to be a celebrity. Communicating obstruction outside the ventricular system, which leads to a decreased absorption of CSF. Okay, let's think about this. Obstruction outside the ventricular system, which leads to a decreased absorption.
I get it.
She doesn't get it. I hope you all get it more than she does. Okay, so obstruction outside the ventricular system, which leads to a decreased absorption of CSF because it's an obstruction, and it's usually seen with premature infants with subarachnoid hemorrhage or infection. So now let's talk about the non-communicating. So one is happening outside, communicating. Non-communicating. This is the obstruction of the CSF within the ventricle system. So the obstruction's inside the ventricles, non-communicating. Usually seen with secondary to congenital deformities such as meningeomyelocele, usually seen in developmental malformations. So remember, if they're seeing any test question, communicating is outside of the ventricles, so ventricles are all communicating in. And if it's non-communicating, there's an obstruction happening right in that ventricle system. So is such a thing as normal pressure hydrocephalus, I want you to be aware of. So they can have a normal pressure within large ventricles and not fully understood, and it's commonly seen with elderly.
Pause. I don't know much about nursing, but I do know that this has bacteria.
I don't know why you want to be in my video so bad. All right, so we talked about the types, we talked about the pathophysiology, we talked about the causes, we're going to talk about the clinical manifestations we're going to see in these patients. All right, so I have it broken down into the normal pressure hydrocephalus, our adults, our infants, and our children. We're going to see different things for different age groups. So let's start with our little infants. So our infants are going to have increased limb tone spasticity, especially in their lower legs, seizure spasticity. They may have the setting sun eyes appearance. Setting sign eyes appears to be I want to look that up real quick to give you an idea. Setting sun eyes infants, because I need to know what it looks like to be able to teach it. Oh, I see. Oh, it looks like this. Okay, look at my eyes. Their eyes are going down. I don't know if I'm doing that right, but whatever. Because I can't see my eyes when I'm like on a video. It's really something to look at. You guys should look that up, man. Okay, so that's what you're going to see though. Setting sun eyes. So you're going to have a large head circumference at or above 90%. Super big heads. Vomiting, lethargy, irritable, fussy baby, poor feeding, anorexia, bulging fontanelles. Wait, I've heard that in meningitis. High-pitched cry, strabismus. I gotta look that up too. Strabismus. It's another type of eye movement. A squint also goes through where the eyes point in different directions. It's particularly common in young children, but also can occur. It's kind of like cross-eyed. It's like cross-eyed, like, you know? All right, that's what that is. So strabismus, separation of the cranial sutures, shiny scalp, and distended scalp veins. So this is like more something you could see in an infant or a neonate. Diminished LOC and sluggish pupil response. So things are happening up there. So for children, we're going to see a change in motor skills. So more of like a change, whereas in babies, you can't see that. Ataxia, spasticity, unsteady gait. They're going to have no head enlargement, but has a large head. That makes sense. They're going to have headache, nausea, and vomiting, irritability. So that's pretty much the same. Lethargy, apathy, confusion. They may have impairment, judging, reasoning skills. Papilledema, strabismus, also with the cross-eyedness, or decreased visual ability. And there's this thing called Mequin sign. So this is a crackpot sound when percussion to the head. So like that's one of like the main things that pops out to me. It's called Mequin sign, M-A-C-E-W-E-N, Mequin sign, M-A-C, Mace-win or Mequin, M-A-C-E-W-E-N, Mequin sign. Okay, so for adults, we're going to see that unsteady gait, incontinence, blurry vision, double vision, cognitive deterioration, headache, usually in the morning. So headache is usually in the morning. They're going to have nausea and vomiting, drowsiness, neck pain. I guess that's a little bit different. Neck pain between like meningitis is nuchal rigidity, like neck tension. For the NPH, the normal pressure hemorrhage would be your seizures, headaches. So that's one of our exemplary seizures. The feet is stuck to the floor. That was interesting to me. They have unsteady gait, dementia, impairment of recent memory, urinary incontinence, personality changes, Parkinsonism. So it's probably pretty hard to differentiate, honestly. So diagnostics. With our infants, we're going to really want to do the head measurement circumferences. For our children, probably like a CT, MRI, and our neonates, maybe an encephalography. So really that's all I have on my notes. I don't know, there must be like a way to tell with like older patients. It may be hard to actually detect. Of course, there's always more research I could be doing, but this is what I have so far gathered together. Our complications, we really should have talked about the interventions first, but our complications is really focused on that VP shunt function. So this is a treatment, a massive dose of antibiotic intravenously or intrathecally for a minimum of 7 to 10 days or shunt removal. Okay, so there's some problems with this that can be like with the abdomen. You want to think of like maybe there could be peritonitis. With the VP shunts, there may be a malfunction, like a mechanical obstruction, worsening ICP, worsening signs and symptoms. So the infection could be, there's a greater risk after 1-2 months of placement, like a risk for septicemia, bacterial endocarditis, wound infections, shunt nephritis, meningitis, all that stuff. All right, let's just talk about real quickly what would be our job as a nurse and what we're going to do. So there is nursing implications. There is a goal for us. So goal is to relieve the hydrocephalus, of course. I don't know which one to talk about first. Okay, nursing implications. Let's talk about that. So we're going to first want to assess our manifestations. Then we're going to want to observe those signs and symptoms, increased ICP. So we want to look for that. Our vital signs, we want to look at neuroassessment. Because at this time, we may not know it's hydrocephalus. We're just suspecting it. Head circumference, preventing infection, preparing for test or surgery, post-operative care, care of the family. This is things that are to be under the nurse's control. All right, so there's an assessment of the problems related to the motor development. You want medications temporary, so like osmotic diuretics. It's like acetylazomide, furosemide, so osmotic diuretics. A VP shunt, so this is through the lateral ventricle peritoneal cavity. Other types are ventricle arterial, which goes to the right cardiac atrium. Ventricle pleural, there's a lumboperitoneal Tarkildison shunt. Okay, so there's all these different kinds of tools. There's the external ventricle device. This may be indicated when the removal of VP is due to infection. There's an endoscopic third ventriculostomy. So surgical creates opening inside the third ventricles, which allows CSF to bypass the obstruction, requires no shunting device. So these are just other options, but we really focus on that VP because it's the most common. All right, so post-operative, what are we going to do? And then I can talk about the teaching, and that is really all I know about hydrocephalus after that. Post-operative positioning. You want to position them on the unaffected side and keep them flat. Yeah. The pain management, you want to give them acetaminophen with or without codeine, opioids for severe pain. Assess for complication. So complication would be like infection. So affection would be elevated temperature, poor feeding, vomiting, decreased responsiveness, seizure activity. Observe for abdominal distension like peritonitis or post-op ileus. Assess for operative sites such as along the shunt graft. Never pump the shunt reservoir to maintain patency, so never pump it. What are the patients teaching? Teach the parents how to identify shunt malfunction or infection. You want to make sure they have good nutrition, decrease exposure to infection. Helmet should be worn and contact sports avoided. A referral, teach to contact HCP if changes in LOC. So really that's all I know for hydrocephalus. Feel free to add information and happy studying.